Do you know everything you need to know about colorectal cancer prevention? My name is Abraham George. I'm a gastroenterologist here in KPGA Johor Specialist Hospital based in Johor Bahru. I'm here today to tell you about colorectal cancer prevention and what you can do to modify your life, take necessary measures to prevent and hopefully prevent this disease from ever occurring in yourself. There is a worrying trend in Malaysia and in Asia and also around the world that colorectal cancer seems to be on the rise. In Malaysia, colorectal cancer is the second commonest cancer overall, the first commonest cancer among men and the third among women. And this data has changed along the years. This data has changed along the years with an increasing incidence of colorectal cancer that we find. Unfortunately, we seem to be finding more and more colorectal cancers, of course in those above the age of 40, but also in those younger, in their 20s as well as in their 30s. This is a worrying trend, and among the cancers in the world that you can get, colorectal cancer is one of those cancers which is highly preventable. That is why we are pushing for colorectal cancer prevention and taking steps in order to prevent this cancer from presenting late in individuals. Generally, we find that a lot of our patients are presenting in stage 3 and stage 4 disease. Just means that their survival is much less compared to those in stage 1 and 2, and the recurrence of these cancers despite surgery, radiotherapy and oncology, other oncological maneuvers and treatments is worrying, because there's a high rate of recurrence of these cancers when they present in stage 3 and 4. And the life expectancy overall drops significantly among individuals diagnosed with late cancer. Now, this can be divided into risk factors which are modifiable and non-modifiable. And of course, non-modifiable risk factors would include things like our age. So those who are above the age of 50, your risk is higher. Other conditions like family history of colorectal cancer, family history of colorectal polyps, personal history of colon cancer, colorectal cancer as well as polyps, diseases that you may have such as inflammatory bowel disease like ulcerative colitis, Crohn's disease. These are all risk factors which are difficult to modify, and those individuals who have these risk factors are at a much higher risk of developing colorectal cancer and require screening at an even earlier age compared to those who are average risk and do not have these risk factors. The modifiable risk factors would include things like diet, so a diet which is high in red meat such as beef and lamb increases your risk of colorectal cancer. Diet which is low in fruits and vegetables, smoking, more than moderate alcohol consumption, sedentary lifestyle, obesity. These are risk factors which we have some control over, and as individuals and as patients we can try our best to change these risk factors in changing our lifestyle, our diet, etc. When we screen for colorectal cancer, we are aiming to look for precancerous lesions that can be removed generally endoscopically before these polyps or lesions become malignant. That is the ideal method and option for screening so that we prevent colorectal cancer rather than trying to treat colorectal cancer when it has already occurred. So screening has developed over the years, and now we have a variety of screening tests at our disposal. The first basic screening test that we have is the stool fecal occult blood, which is the guaic-based highly sensitive test. Now, this test is slightly more difficult to do because it requires specific dietary restrictions for a few days before doing the test, and the pickup rate to detect early cancers or even polyps is not that good. The next stool test we have is something called the fecal immunochemical test. Now, this test is rather new and has been available for the last few years. This test uses a specific antibody to detect blood in a stool sample. It comes generally in a kit which is already prepared, and an individual can do this test at home with the kit. It is fairly simple to do. The instructions are very clear. You take your stool sample, a portion of your stool sample, and send it back in the kit to your healthcare provider, and they will give you an answer in generally less than a week whether this test is positive or not. Now, fecal immunochemical testing compared to the previous guaiac-based fecal occult blood has shown to be much more sensitive in picking up colorectal cancers as well as picking up polyps. However, the chances of picking up early polyps or smaller polyps is still not as good as what we would hope it to be. But if a stool fecal immunochemical test is positive, then an individual will be referred for a colonoscopy. Now, a colonoscopy is considered the gold standard for screening, and it requires a bowel preparation. That means patients will be given a specific medication to take the day before the procedure to clean out their bowels. And once they have cleaned out their bowels, they come to the hospital and they will be given a sedative, injectable sedative, and they will be asleep, and then the procedure takes place. Generally, a colonoscopy takes about 10 to 12 minutes to do. It is quite painless, and it requires an endoscopist to do it in an endoscopy unit. Now, during the colonoscopy, any suspicious lesion or polyp will be removed right away during the colonoscopy using a method called a polypectomy. Then this polyp will then be sent to the laboratory for analysis to decide what kind of polyp it is, because there are different kinds of polyps in our colon, and all these different polyps have different risk factors for developing cancer later on. So once the doctor then has the result of your polyp, he will then be able to tell you when you need to repeat your colonoscopy, and generally this varies depending on the number of polyps that you have, the size of the polyps that you have, as well as the histological report of the polyps that you have. Like, this period may vary between 6 months to 3 to 4 years. So an individual who has gone for a colonoscopy and has a negative colonoscopy, meaning absolutely no polyps, then generally that individual does not need to repeat a colonoscopy for 10 years. Unless they have risk factors in their family, such as a family history of colorectal polyps, especially high-risk colorectal polyps, or a family history of colorectal cancer, or a past history of colorectal polyps, then that screening interval may be reduced to 5 years. Please remember that screening is for individuals who do not have any symptoms at all. Now, if you do have symptoms that are in any way worrying, such as weight loss, diarrhea, change in bowel habits, change in the consistency, the form, the color of your stool, abdominal pain, discomfort, bloating, unexplained weight loss, iron deficiency anemia, all those signs require a colonoscopy to be done, and therefore a person with those symptoms should not wait for the age of 50, and they should see their doctor as soon as they develop those symptoms. The other option of screening is called a virtual colonoscopy or a CT colonoscopy. This involves a CT scan machine. However, the bowel preparation is the same as if you undergo a normal or a regular colonoscopy. When you do a CT colonoscopy, a CT scan takes pictures of your colon and then it is reconfigured, and a radiologist then looks at the images and looks for potential polyps or any growths in the colon. If the CT colonography does show a suspicious lesion, then that patient will have to be referred for a regular colonoscopy, which will then have to be done by an endoscopist. So remember, lead a healthy life. Exercise, lose some weight, reduce your red meat, eat more fruits and vegetables, and never forget to do screening. Always see your doctor if you have any symptoms, and let's beat this disease once and for all. Thank you for watching this video. If you have any comments or queries, please feel free to leave a comment or to reach out to us. If you like the content of this video, please subscribe to Medical Channel Asia.